Well, good evening, everyone, and thank you for joining us on the National Wellness Alliance web series. Today we're going to be talking to you about a nutritional support protocol that will enhance your periodontal treatment outcomes. And, considering the systemic ramifications of periodontal disease, it's now even more important than ever to effectively control, or if we could, completely eradicate periodontal disease. I'd like to introduce you to my business partner, Becky Matthews, who is a dental hygienist in Austin, Texas. She and her husband, who's a dentist, have been practicing for over 30 years. And when she and I discovered this technology, we saw the potential for overall health benefits, but we really weren't sure how we could relate it to dentistry. So I'm going to let Becky share with you her story about the process that she used to validate nutritional support as a critical component of any periodontal therapy program. Becky?
Jackie, thank you so much for that introduction, and I can't tell you how honored and excited I am about being with all of you on this webinar, because this has become a story and an event that's very, very close to my heart, because I can honestly say that this has not only changed my husband's and my life, but we have been able to make a huge difference in the lives of our patients and many others. I would even say more so than I was ever able to do as a dental hygienist. So I'm extremely grateful and excited about sharing this journey with all of you. It's been probably about 8 years ago. Dan and I were 51, 52. We realized that we just weren't feeling the same as we had always felt in our younger years. We didn't quite just seem to have that vitality, that same energy. We didn't jump out of bed in the morning raring and ready to go. My focus was a little off, and, we just realized, I think at that point more than ever, we just weren't bulletproof, and we were going to have to do something above and beyond to stay healthy and keep our vitality. So we actually went to visit a physician who was in our practice, and he did this extensive blood work on us, extensive hair testing. I can't even tell you what else. I can't remember what else we did, but basically testing us so that he could compound a nutraceutical, for his use of words, that was custom for us so that we could regain that vitality that we had when we were younger. So to the tune of about $350 a month each, we were taking these custom nutraceuticals, and I have to tell you, I never really noticed much of a difference, and I just had to have the faith that we were with the right physician and he was doing the right thing, and surely at this expense, we were doing the right thing. So, needless to say, when Jackie introduced us to the biophotonic scanner and the nutraceutical solutions, I was very excited for many reasons. One, because we had always believed in the importance of nutrition in our dental practice, and we did do some nutritional counseling, but we've never been able to take it much further than that because we were never willing to bring supplements into our practice, because how did we know which ones worked? How did we even know our patients needed supplements? Because there was no way to test their nutritional health and to see whether or not their diet was supporting them or not. So it was not as in-depth of nutritional intervention and counseling as we would have liked. But upon seeing this piece of technology from Pharmanex, it gave us a lot of hope that maybe we finally found that diagnostic tool that would help us do that. And being the competitive person that I am, I knew that being on my custom compounded nutraceuticals that were so expensive, in my opinion, I was going to blow this thing up. I was going to score higher than anybody had scored. Needless to say, I was very disappointed. We brought the technology in to try. Dan scanned, I scanned. We both basically failed. We were in the low 20s. I was devastated, and all I could think of was either my nutraceuticals were not working and a scam, or this technology was a scam. And I certainly don't like to be wrong. And so we started scanning our team and some of our patients just to see kind of where everybody else fell in. And we were also shocked to see that many of them also failed. So Dan and I said, the fair thing to do would be to switch products and try the PharmaNex product and start really doing our due diligence to see, is this technology real? Is there some hard science behind it? Are these products real? Is this company the real deal? Because we just had no way of knowing, except that we trusted Jackie and we wanted it to be the truth. We just needed to find out for ourselves, because obviously we'd spent 25 plus years in dentistry building a reputation and our credibility, and losing that was not worth any piece of technology or product that might come along. So we did just that. We changed and started using LifePak Nano. Our team started using it, and we actually started feeling differently, not to mention the fact that our biophotonic scans started going up. And so now you've got my attention. I'm thinking, well, maybe there is something to this. But being in dentistry and, of course, being interested in what this might do for our patients and our practice, I've got to see this for myself. I can't just see scan scores going up. I need to see how this is going to manifest itself in the mouth, more specifically periodontally. And we know there's an abundance of literature out there that supports that antioxidant status and periodontal health are very, very closely related. But again, I needed to see this for myself. So I took 40 of my patients that I had treated for quite a while, and I didn't pick patients that had severe periodontitis. I wanted to, take my patients that were slight to moderate, because if you treat periodontal disease in your practice, and by the way, we were a zero bleeding tolerance practice, meaning if you got bleeding upon provocation or instrumentation, you had disease in your mouth. I just can't tell you the number of years that I struggled with trying to get these people completely healthy, and it just seemed like I was beating my head against the wall constantly. So I took 40 patients, and we asked them to do one thing, actually a couple of things, two things, and to do those only. They were to agree to take the supplements as directed, not to change anything in their lifestyle, not to change any of their oral hygiene habits, and to agree to come in once a month so that we could rescan them, take other photos, and do comprehensive periodontal exams on them to see, does nutritional health and antioxidant status really make a difference in your periodontal health? Well, they did. We placed them on LifePak Nano. We asked them to make a commitment for 120 days, scanned them all, took them through comprehensive periodontal exams, and our initial findings didn't surprise me at all, because obviously I'd been treating these patients for quite a while. The average scan score was 27,000, which we had kind of found to be the score for the average American, very, very low. We measured 168 periodontal sites in the mouth, all of the teeth, 6 sites for each tooth, excluding the third molars. On an average, there were 50 periodontal sites bleeding and inflamed, basically leaving about 30% of the mouth diseased. Well, I have to tell you, after 120 days, I truly was excited, but pretty much shocked and blown away by the fact that the average scan score went to 51,000. We measured those same 168 periodontal sites, and it went from an average of 50 inflamed and bleeding sites to 10 in the mouth, basically leaving the mouth about 6% of the mouth diseased. That was an 80% improvement in the number of healthy sites in the mouth. I had never seen anything like that before with simply just changing someone's nutritional health. The other thing that got me really excited about these scores was that these biophotonic scan scores are actually measuring oxidative stress in the body And research has proven that it is inversely related to F2 isoprostane scores, meaning that we can basically non-invasively and in 30 seconds very affordably test someone's oxidative stress in their body. And if you are very aware of the fact that we now have an abundance amount of research that supports the direct significance between periodontal disease, pathogens in the mouth, oxidative stress, and cardiovascular disease, this is a huge piece of information that we can get from our patients, along with what we can get by looking in their mouth to help give them a really good idea of what their cardiovascular risk is, and do it, again, non-invasively and affordably. So I was, I'm done. I bought in. It was amazing. This has probably been the most exciting piece of technology that we have ever implemented in our practice as far as what we have been able to do for the health of our patients. So we now can conclude after this that raising somebody's nutritional health and their antioxidant status has a significant impact on the amount of oxidative stress in the body and the health of periodontal disease, or the health of your periodontium in the mouth. And lowering this oxidative burden makes a huge difference. So these two things in combination with some periodontal therapy, I have seen actually take people to a level of health that I had never seen before in the practice, just by using oral or subgingival antibiotic therapy and periodontal therapy. I can't think of a better way to help your patients than to help teach them how to eat better, how to give them solutions to help raise their nutritional health and do it in a natural and healthy way without the use of antibiotics, and actually see them take not only their oral health, but their overall health to a whole new level. Jackie, it's been an amazing addition to our dental practice.
Well, Becky, I'm just so proud of what you and Dan are doing in Austin. I mean, this whole holistic approach to dentistry, we know that we can't fragment the body anymore. What happens in the mouth does not stay in the mouth. And so if we're doing something that is not only good for the treatment outcomes of periodontal disease, but it has a positive impact on the body, I just don't know how it can get any better than that. And I just want to applaud you and Dan for being those, forward thinkers, those early adopters, and I really appreciate you being part of this short webinar with us tonight. I want to invite the listeners on the call to, if you have any questions or if you'd like to participate in a similar study, we're trying to duplicate this case study all over the country so that we can really start making some paradigm shifts in the way we approach periodontal treatment. So, Becky, thank you, my business partner and dear friend. And thank you, listeners. Be healthy, and let's help others be healthy as well. Thank you, and good night.